We're going to crack on this morning talking about pain physiology and the pathophysiology of pain. I will try and make it as painless as possible, particularly for first thing in the morning. So what we're going to try and cover in this talk is discuss a little bit what pain is and what we think it is, because unfortunately it's a really subjective thing. And then we'll talk a little bit about the pain pathway, so about transduction, transmission, modulation of pain and perception. And then a final bit about, very briefly, central and peripheral sensitization. So I promised you interactive. So we're starting it with what is pain. So I'd throw it out to you guys and say, what do you guys think of as pain? What does it mean to you? Anyone feeling brave first thing in the morning?
Unpleasant feeling.
Unpleasant feeling, yeah, absolutely. Perfect. Great start. Enya?
Like a negative physiological and emotional response to something.
Yep, so negative physiological emotional response to something, absolutely, yeah. Yeah, these are all really good answers. So I think the key is that, to start with, is that pain is a highly complex physiological and psychological phenomenon. Okay, involves a huge amount of different things that are interplaying with one another. It can be both beneficial and harmful to the individual experiencing it, depending on the type of pain it is and the situation that we find ourselves in. But the most commonly quoted definition comes from the International Association for the Study of Pain, so IASP, which is this lovely one up here, an unpleasant sensory and emotional experience, so perfect definition there, associated with actual or potential tissue damage and can be described in terms of that damage. So I think that is an important quantifier, that actually even potential tissue damage or anticipated tissue damage can result in pain in our individuals. Another definition that crops up, which is meant to be slightly more veterinary specific, or at least more specific to non-verbal patients, is that it's an adversary sensory or emotional experience representing an awareness by the animal of damage or threat to the integrity of its tissues. Okay, and that's specific to animals because obviously we are dealing with non-verbal patients. The big thing I would say with pain that's really important is that in non-verbal patients, be them human or veterinary, the inability to communicate pain doesn't negate the possibility that they're experiencing it. So the fact they can't tell us in pain, whether they're animals, babies, people in comas or non-verbal humans, it doesn't mean they're not experiencing it. Okay, which I think has been a huge cultural shift that we've seen in the last probably 10 to 15 years in the Western world. That actually people are saying, yeah, okay, you know, you may be a tiny baby and you can't tell me you're in pain, but you're still experiencing it. So in terms of what kind of pain our patients experience, there's a huge variety of pain that our veterinary patients can experience during their time in the clinics and also away at home. And that we have to be able to be aware of and also think of ways to manage and prevent wherever possible. So the first type of pain, obviously stood here with our little dog getting his vaccination, that is what's termed as short-term procedural pain, so associated with things like venipuncture, vaccination, intramuscular injections, and the pain associated with that should not extend past the point of you doing that procedure. So if you take blood off an animal, it shouldn't be in pain once that needle has been removed or once it's gone through the skin. Okay. Yeah?
I'd like to follow that because when I've had a blood test,
Yeah.
my heart hurts afterwards.
Yes.
Is that psychological?
No. It's not. And this is so. It's just this is the first way we classify it. So in terms of why, if you have a blood sample taken and then you have pain afterwards, that's actually because we'll talk a little bit more about fast pain. So the fact you get initial firing of your A delta fibres, which tell you that first stab, and then you get C fibres and you get inflammation, which gives you a bit of sensitization. So no, it's not. But it's, I guess we're starting off with it because it's the way we think about it. You think, oh, well, I'm just giving him an injection. Don't be ridiculous. The other big thing that we'll talk a little bit more about is obviously there's a huge input in terms of perception of how you perceive pain, which is very much down to the individual, be them human or veterinary, which will be reflected on your past experience, your emotional state at the time. So if you're stressed and you're wound up, we know that people don't tolerate pain as well. We know that animals don't tolerate pain as well. So there's a huge amount that comes into it. So I do agree with you. I know this is an oversimplification of it to start with.